Hi everyone, good morning. My name is Michael Kapps. I'm the founder and CEO of TNH Health. I am from Sao Paulo, Brazil. It's a city of 20 million people in a big country of 200 million people. And what a lot of people don't know about Brazil is that actually it has a pretty big mental health care crisis. According to the World Health Organization, it leads the world in prevalence of anxiety disorder. They even say that about 20% of the inhabitants of Sao Paulo have anxiety. And they say that Brazil is number 4 in terms of prevalence of depression. So, in the world. And I mean, there's a couple of reasons for this, because you think Brazil, you think, the beach and carnival and things like that. Well, there's a lot of reasons for it. One is it's one of the most violent countries in the world, 60,000 murders per year. About 3% of the population was robbed at gunpoint at any given time. Divorce rate has gone up about 10 times. A reported divorce rate has gone up 10 times. Unemployment rate has doubled in the last 5 years. And the city, people are it's rapidly urbanizing as well. Now, the issue is, mental health gives you a lot of problems, a lot of suffering, depression, anxiety. We know that also it exacerbates chronic conditions. A diabetic patient who is depressed will cost the health system twice as much as a diabetic who does not have depression. And obviously it affects the workforce as well. People don't come to work, they're not as productive, so it costs companies billions every single year. Now the problem is that still for a majority of the population, mental health professionals are just too expensive. Right? And in fact, there's actually not enough mental health care professionals in Brazil and in similar regions, about 5 to 10 times less per inhabitant than in the US and Europe. And a lot of employers and people like that use, call-in programs which aren't particularly effective. People don't tend to use them. So we thought, okay, we can't get people out there. What's the solution? Let's try to come up with robots. So we came up with a technology service called VTalk. It uses a digital health assistant, a little chatbot named Vicky, and she's sort of like a person's guide to their mental health. Okay, so people talk to her via text messaging on any channel, whether it's web, whether it's on a mobile device, SMS, Facebook, really any social media. You don't even have to download an app. If people are already using SMS and WhatsApp, that's where you'll be talking to Vicky, our mental health robot. I'll show you a little bit about how it works. Basically, we'll just switch over here. Vicky uses a very informal tone, so she'll send a lot of GIFs and memes and talk about celebrities and recipes and things like that. And there's a lot of sociocultural content around that. And so people are highly engaged with her. And users can choose the type of content that most interests them. And over time, Vicky learns from the user. So if the user likes to respond in the morning, she'll start to send messages more in the mornings. They like, some information about celebrities, she'll start talking about that. The idea is to keep the engagement rate very, very high. I'm going to switch over to the next slide. Now, if Vicky can't identify a certain issue or identifies a certain risk, she lets a care team know. So there's actually a team of nurses and psychologists behind the robot who are identifying patients, and then they get in touch, chatting with the patient or giving them a call. Okay, and this way we have some pretty great coverage. Now, Vicky talks about a number of different areas, from relationships to conflict at work, goes through breathing exercises, things that are really relevant to the particular context. And there's an entire team of people. We have doctors, psychologists, nurses, who are constantly creating this kind of content that's really relevant to Brazilian society. And it's a 25-person team that's growing a lot. Now, in general, what we've been able to do is we've been able to show that a single healthcare professional can manage up to 4,000 people at the same time. Because the healthcare professional will just go after those particular patients that have that issue. So we've been able to decrease the cost of monitoring populations significantly. Because Vicky is connected 24/7, the patient can constantly be talking to this chatbot. We can identify particular healthcare risk, whether they're mental health care or other types of areas, significantly earlier and act before those issues are exacerbated. And because we're really focused, our main KPI is engagement, getting that patient to be constantly responding, we've been able to maintain a really high engagement rate. People really, really like talking to this chatbot, and they can sustain that engagement over time. Now, we currently are using a model in which we have a free version for all Brazilians, and the more people that use it, the better the AI becomes, and the higher the engagement rate goes, and the more people that a single healthcare professional can attend to. But we also sell a premium version to payers and providers with premium content, with data, and things like that. Now, we work with a number of healthcare players in the entire healthcare value chain, from pharmaceuticals to providers to payers to employers. We've been able to, in Brazil, and we're very happy to announce that we got our first US client. We've actually been able to do a little bit of reverse innovation, and we're going to be applying our chatbot jointly with a predictive model that'll take into consideration clinical data as well as social determinants of health to try to affect low-income populations right here in Baltimore. Try to engage them and try to avoid basically reinternations and things like that. We've had a lot of support from a number of different organizations, and my ask for you today are the following three things that I would really, really ask for help with. I think the first is we have a pretty innovative technology, and we really want to pilot it. So if there's any organizations, any health systems, providers, pharma companies, what have you, that want to pilot and test it out, I think that's very, very important for us to get more users to be using our service. The second thing is we have proven that this system has worked really well in low-income communities in Brazil. We want to try to see if we can get it to work in other countries, especially in the United States. I think there's a big Hispanic population here. I think we can apply a lot of those lessons learned and how to engage people and identify risks over here in the States. And obviously, I think clinical validation is very difficult, and for a startup, for a company such as ours, it's oftentimes difficult to invest in studies and grants and things like that. So even we're looking for a little bit of grant funding just to validate and have a little bit more evidence base behind what we're doing. Well, that's my presentation. Hope you enjoyed it, and be looking forward to talking to you later. Thank you so much.